We're nearing 6 months since the World Health Organization declared COVID-19 a global pandemic. Yet the number of infection cases we see day by day are not slowing down. Countries that claim they flattened the curve are being hit with a humbling reality as the second wave of infections strikes their populations. We're also seeing a growing proportion of young people catching the virus, which appears to be mutating to become even more infectious. With no end in sight to this pandemic until a vaccine is developed, we address these various concerns with our guests today here on Global Insight. We have joining us again Dr. Stanley Perlman, professor at the University of Iowa, who has been studying coronaviruses like COVID-19 for the past 4 decades. Welcome back to the show, Dr. Perlman.
Thank you.
We also connect with Dr. Kwon Soon-man, Professor and former Dean of Public Health at Seoul National University. Lovely to see you today, Dr. Kwon.
Thank you.
Well, my first question to you, Dr. Perlman. As of this week, as of Wednesday, there were more than 22 million COVID-19 cases worldwide, accumulated figures, of course. And we're nearing 6 months since the WHO declared COVID-19 a pandemic. Does it surprise you that this virus is lasting so long? And why is it so hard to contain it?
I don't think I'm surprised that it's lasting so long. This is a virus to which humans have no immunity. And we also know that the virus spreads very readily. It spreads like a cold virus, in fact, if not better than some cold viruses. And you put these two factors together, it's very hard to control infections like this. In countries where there were lockdowns, the virus was basically eliminated. But even in those countries, one has to fear that the virus will come back as soon as the conditions are relaxed. It's just really hard to control a respiratory virus, and I think that's what we're seeing here.
We're definitely seeing that in Korea. And Dr. Kwon, here in South Korea, we have been talking about a second wave for quite some time, ever since the Itaewon cluster infections. Are we now experiencing a second wave? And how do we define a second wave, really?
Actually, as far as I know, there is no agreed upon criteria, clear definition of second wave. So all we can do is we should be prepared for even worse situation. And in my view, I think it's quite a serious situation now in Korea, for several reasons. For example, we have a very large number of new cases, and another factor, the rate of increase is quite high. Plus, there are increasing proportion of confirmed cases that we cannot trace the source or pathway of infection, and plus, it's now occurring in multi-localities. Because, as you know, it is very closely related to a major big demonstration gathering in Gwanghwamun area during a few days ago. And there are many people from all around Korea. They gather to that place, and then they come back to their home. So it's a very alarming situation. So even though I cannot say whether it's the second wave or not, but it is a very serious and alarming situation now in Korea.
It is very concerning indeed, because, Dr. Kwon, you might remember that when the virus first broke out, medical workers in the city of Daegu, which was the epicenter then, was overwhelmed with patients, and doctors were working through the night, covering themselves with bandages because they didn't have enough masks. Is South Korea's medical system at least a bit more prepared for a second wave now?
Well, it is. I can say that we are better prepared than before, than the situation of Daegu Gyeongbuk in March. That's true, but still, we don't have enough special beds for the serious patients of COVID-19, and we need more personnel who are trained to take care of this type of severe COVID-19 patients. As you know, we have, in terms of overall number of hospitals and beds, we have enough beds in Korea. But the majority of the beds in Korea are private, and private sector hospitals are not very willing to treat this COVID-19 patients because of the potential infection issues. So the majority of the patients are treated in the public hospitals, but in Korea, only about 5 or 6% of all hospitals are public. And also, we don't have enough beds for high severity level of COVID-19 patients. So in that sense, this type of rapid increase in the confirmed cases will result in also in the rapid increase in the patients who need a severe intensive care in hospitals. So in that sense, government should work hard to allocate a designated more hospital beds for severe COVID-19 patients, and also we should mobilize more nurses and doctors. But that is an issue because it takes time to mobilize more healthcare personnel to this sector. Yep.
Well, really, hopefully we won't get to that point where hospitals are just overflooded with patients once again and doctors just sweating through those hazmat suits and working day and night. Well, Dr. Perlman, here in South Korea, infection rates are still comparatively low compared to other nations. But then does this mean that we are much more vulnerable to mass infections like these, or when the virus hits in winter, for instance?
Yeah, I don't think we know the answer to that question yet. I think that what we think is that there's probably 5 to 6 times as many actual cases as we pick up in our official tallying of cases. I know Korea has done a really good job of counting cases, so then maybe it's not true for Korea. But for most parts of the world, testing is lagged behind cases, so we are deficient in the number of actual cases. But I think in every country we worry that even at 20% or 15% coverage or vaccine, 15 to 20% of people having evidence of having seen the infection and maybe being immune to it, we worry that there's many people who can still be infected. We know that herd immunity cuts in, or we think we know, at about 60 or 70% of the population. 20% is certainly not sufficient to provide herd immunity, but it may do something to help slow down the rate of other people getting infected. The main goal is to protect old people, elderly people, and people who have underlying conditions from getting infected, because they're the people who get severe disease. And in a lot of countries, the people who are dying from this are still people who are in nursing homes. And so they're the ones I really worry about, even if 80% of the population remains vulnerable.
Of course, it's crucial to make sure that the virus doesn't lead to more transmissions and unnecessary cases as well. In that regard, authorities here in South Korea, Dr. Kwon, they've imposed stage 2 of social distancing measures where high-risk entertainment and leisure facilities are restricted from operating. Do you think this is enough? I mean, people are still going to work and they're still sitting at cafes, talking for hours on end.
Well, there's a huge uncertainty, so I'm not sure whether it's enough, but there's a dilemma because we call it, there's a trade-off between saving lives and saving livelihoods. From a just medical or healthcare perspective, maybe we should increase the alert level to level 3, even higher than level 2. But we should pay the socio-economic cost of a high alert, right? Because when there's more strict or more restrictive measures implemented, as we move toward a more serious levels of social distancing, maybe we can decrease the infections, but there's a socioeconomic cost, like people are suffering, and economy can be worse. So I think from a broader policy perspective, we should have a balanced perspective, taking into account not only the healthcare sector, but also the economic and social sector as well. So they're all interrelated. So I can understand the government's dilemma. So in my view, rather than moving further, we can see the trend of the cases, and then you should make a decision whether we should increase the level. Up to 3 in just 2 or 3 days from now. And also, there's a huge enforcement issue. If we increase the level up to 3, most of those activities will be banned. Then there should be an enforcement, right? Because if the level 3 means that those facilities should be shut down, no gatherings, can you imagine how many churches, how many bars, how many restaurants? It's very costly to check and enforce that all of those facilities comply with this government mandate or guidelines. So we can say that there's no sports games and no concert in the public concert hall, but the majority of those places are in the private sector. So I think we should have this take into account this trade-off and not only the health impacts, but also its potential impact on other sectors as well. Over.
So it's really the trade-off that's the dilemma here. And well, Dr. Perlman, what are your thoughts on this? With the situation in America as well.
Yeah, I think that this is the same kind of dilemma that people who think about this disease anywhere around the world to face. Because on one hand, you don't want to so restrict economic activity and social activity that you have long-lasting and bad effects. But on the other hand, if you open up too soon, which occurred in many American states, then you have the problem of recurrence of the disease. Or in my state, which never actually really shut down, there's never really been a decrease in cases. It's been at a plateau level for several months. So you have to follow the science and the healthcare authorities to some extent, because you don't want numbers of cases to increase greatly. But as Dr. Kwon said, it's really important to consider the economic consequences, the social consequences, and the mental health consequences of having too much restriction.
Right, it's not a simple thing really to sort out. And well, Dr. Perlman, recently there have been news of mutated strains emerging around the world. Here in Korea, scientists have detected 3 new strains among imported cases earlier this month. And in Malaysia, scientists found the strain 10 times more infectious than the original Wuhan strain. Then if all of this is true, then does that mean that COVID-19 patients can get the virus again? And what does this really mean for vaccine development?
Well, so far, most of the information that's come out has not been really, the viruses are isolated from human patients, but there's not really any evidence that the viruses themselves cause worse disease, at least as far as I know. The strains certainly are worse in being able to infect cells in test tubes, but so far not in people. There's one mutation that seems to be taking over populations, and this may be real, but there's no evidence that it's actually causing worse disease or is more easily transmitted or is resistant to any vaccine. So far, there's no evidence that any of these changes really matter very much. We know that these viruses readily mutate. They really don't have a way to correct errors, and if there's a slight advantage, one virus may take over a population, but it may not really affect the human population to any extent. What we'd worry about is if there were changes that made the virus unable to be recognized by antibodies induced either by the infection or by vaccines. And so far, there's no evidence of that at all. So right now, we have so much information that we're gathering that we really can't interpret what it means in terms of human disease. So I think that's where we are with that kind of information right now.
Well, maybe that's a relief to hear, really, that we don't have evidence yet that mutations will lead to more serious infections. Well, Dr. Kwon, most people expect the vaccine, most experts expect a vaccine to be available by 2021. But in the meantime, what are some policy goals or initiatives that health authorities should prioritize to safeguard public health here in South Korea?
Well, I think still personal, especially wearing a mask is the key, the most cost-effective response to this COVID-19. So, I mean, but the weather is, in this hot weather, humid weather, it becomes more and more painful to wear a mask. But without, I mean, this is most fundamental and most cost-effective way to cope with this COVID-19. And then the problem is, I mean, overall, the Koreans, they're quite good. I mean, most of the people are wearing a mask, but the issue is that the wearing a mask in indoor. For some reason, there are still some people have some misunderstanding that, well, they are wearing a mask in outside, but once they get into the inside the building cafe, they tend not to wear a mask. But I mean, that is wrong because and recently we had a huge infected cases in a cafe. So there's a potential. I mean, there's still controversial, but it is possible that the aerosol that this COVID-19 can be transmitted through aerosol inside, especially with a very strong air conditioning. So I think people should more vigilantly keep wearing a mask inside. But I think outside activity should be okay in a sense. So like a sports games, I think 10% or even 20% of the seats can be allowed for the for the people to enjoy the game. So I think the communication should be slightly changed such that it's not just the mask everywhere, but it's much more important to wear a mask inside subway or inside cafe, and then. Still, for mental health, perspective and overall health perspective, I think people they should keep exercise outside of outdoor basis. So, in a sense, we should be very vigilant. We should be very cautious, but at the same time, we should not be too overwhelmed by this COVID-19. I think government should provide a positive message, and at the same time, government should be more focused effort to increase these public health measures in the facilities with so-called high-risk areas like bars and the areas where people gather together and drink, speak a lot, even shout. So. The government should have a risk-based and targeted approach such that we should pay more attention to the elderly care facilities, and Dr. Perlman also mentioned, and the people with existing disease and places where there's more higher risk of infection. So that kind of targeted approach is more cost-effective than the across-the-board uniform level of public health measures over.
So really it's all there in the messaging, and the messaging needs to change. It can't just be, restrictions in general, but it needs to be more targeted and more specific to our daily lives. Well, I'm afraid this is where we're going to have to leave the discussion, but that was Dr. Stanley Perlman, Professor of Microbiology and Immunology at the University of Iowa, and Dr. Kwon Soon-man, Professor and former Dean of Public Health at Seoul National University. Thank you both so much for joining the programme.
Thank you.
And to our viewers, thank you for watching. We'll be back at the same time tomorrow. Have a good one wherever you are. Goodbye.